I'm in my third outpatient practice, and I got my first taste of, as like, most interventionalists grow up as hospital brats, and you never get out in the real world of private practice medicine. And I had an opportunity to do an MBA program in 2004. And my thesis paper was to do a vein center, and the medical practice I was working with at the time said, great, do it. So that was the first opportunity I had to be really spending, 2.5 days a week outside of the hospital. And it was a real eye-opening experience to be in a smaller environment that you have a lot of control over. And it really opened my eyes to, it was a great way to deliver medicine. So, looking at these relationships and OBLs, certainly you guys down in the Southeast have a lot of these around. Up here in the Midwest, they're less common, but there's a gazillion different permutations of these relationships, and they can get really complicated in terms of the financial end of things. So it's there is absolutely no one solution. These are done very, very differently. So you need to really do a lot of research and to ask people for help. So this is our new center. We cohabitate with a cardiologist, which is the PCC. We're VI. So we have beautiful waiting room, which is really comfortable. Our clinic area, which is here, consists of 7 rooms. So, typical sort of exam rooms. And we have a stress echo room. Here's our nursing and tech work area. So we do stress echo. Then we have our own physiology room here for doing ABIs and ultrasounds and treadmill testing. So we have 2 ultrasound rooms, 1 stress echo room, and then 4 clinic rooms that we use. In our center, we have a CT scanner. So this is for just doing CT guided. Well, we do a lot of diagnostic work that's not part of what I do on a daily basis, but we're affiliated with a multi-specialty medical group practice. So they use the CT, we use it for biopsies and ablations and other stuff, but it gets used for a lot of different things as well. But it's really nice as an interventional center to have that CT scanner, so you can troubleshoot things. For instance, we had a pseudoaneurysm that we couldn't tell what was going on yesterday. This is our break room, but we were able to scan the groin, see the pseudoaneurysm, and then go back and repair it. So here we have our clinic area, or our procedural area. We have 4 prep recovery rooms, nurse's workstation, and then we have 2 procedure rooms. This is our smaller room, which eventually we use it for venous work right now, but we'll use it as, we can put a mobile C-arm or a really small fixed room. And then this is our main room, and you can see we've done away with the traditional control room where the techs just sit around and watch all day long. So, in our environment, we don't want to pay people to do nothing. So, but this is our main room. So you can see it's a beautiful room, Siemens Z ceiling mount, all the toys that go with it. So that's what our new place looks like. Was, like I said, about 7,000 square feet and a little over $3 million to build and equip. And so, in this world, there are really 2 different people that you're going to be dealing with, us and then them. And business people are really different than physicians. And I think as physicians, not just interventionalists, but across the board, we get into trouble because, or we frankly can be taken advantage of because of the way we think. And, so we're used to always putting other people's agendas ahead of ours. And that's what you need to do in patient care. So, we come in with this can-do attitude. We always do the right thing. When it's 5 o'clock and you'd rather be outside on the beach and someone needs something done, we stay and we do it. And so we have this willingness to put others first. And when it comes to business, this is a very dangerous mindset to be dealing with these people. So that's sort of my word of caution. And then business people, they're really a whole different variety of business people, and they come with different levels of education and different levels of background and really different skill sets, right? Like a guy that's good at sales may be terrible at operations, or an operations guy may not have any vision or may have no tactical skills in terms of engaging the market. But the number one thing I think you really need to realize with business people is they don't care about you. They look at you as a way to make money, and that's fine, but you really need to recognize that they're not vested in the patient, they're not vested in the referring physician, and they're not vested in your career unless there's a financial reward for it. So it's really, you need to keep that in mind. I'm not saying you don't have to deal with these people. We have to deal with them, but they don't share your interests. And be wary of the guy, the private equity guy that says, don't worry, our incentives are all aligned. That's not true. So, you know, this is our differences in mentality, right? You get asked to do something on a Friday at 5 and we stay and do it, but the business guy, he's not going to stay and do it. He's actually been on the golf course since noon that day. So you have to use a lot of caution when dealing with them. And I think as physicians, we really fail to recognize that we're the product. Particularly, you know, it's one of the big differentiators between being a proceduralist or an interventionalist compared to a diagnostic guy is what we do is the product. It's not the business. It's not the physical location of the business. It's you and I. And that differentiates us from IR. You know, IR people more think, or DR, there's the imaging center. So it's the business name, it's the physical center, and it's really more of a commodity product, where IR is not a commodity product. When we do these things, you need help. You just can't possibly manage to run one of these things on your own. It's so you will engage with some sort of management company to help you. And these things get, you know, there's a lot of things that you need to have to get one of these businesses up and running. And it's not to frighten you when you look at this long list of things that need to get executed, but it's why you need help. You just can't possibly manage all of these issues on your own. So you need a management company to work with you. And again, it really depends on who owns this company, and you need to understand these things and what drives their decision making, right? So are they venture capital or private equity? And I really, really, really urge caution for anybody getting involved in a company that's in this cycle of their life, because there's only one thing that matters at a venture capital and private equity level is return on investment, period. And these companies go through life cycles of ownership. So you don't want to end up in a management company that somebody's trying to buff up and make the numbers look good because they're trying to sell it, when perhaps you're in a different cycle of growth and you want to be spending money to grow your practice. So these are questions you need to ask people when you get involved with them. You know, what do the owners want to do with their company? And, you know, this is a concept that I think a lot of people don't know, but really need to understand, right? What is a stakeholder and what is a shareholder? And we tend to be more of a stakeholder, right? Where we have more than just financial interest in the business. You know, we live in the community, our patients are in the community, our referring physicians are in the community. So if we don't approach, and we shouldn't approach things as anything other than stakeholders, and business people are shareholders. They don't care about anything other than financial performance, really. And so, you know, we juggle a lot of things, right? We have to juggle our patients' best interests, the health of the business. We have to manage, you know, our resources. We need to make sure we're doing quality care. We have to make sure our staff are happy, but you're working, you know, they're working hard for you, and you need to keep your referring physicians happy. So there's a lot of different things pulling us in different directions. And so really, you know, there's this kind of this conflict of interest that you need to manage with all these different agendas pulling you in different directions. And this comes back to this idea of what's a shareholder and what is a stakeholder, and how do these two dichotomies play out in your relationships. And so this gives you some malalignment, right? Your interests really aren't all aligned. And so if you're working on with a management company, how are those people getting paid? When do they get their bonuses? And what motivates them to make decisions that affects your business? And so this is a really important concept. To give you an example, it might be the end of you're getting close to the end of the year, and you need to buy something, a piece of equipment, or you need to add an employee. Your management company is looking at you or your manager, and they're like, yeah, can we just hold off for a little while? And the reason they want to hold off is because we're hitting the end of the year, the numbers are looking good, and the bonus is going to be good. Whereas you're maybe in the position where I really need that piece of equipment that's affecting care. And so you need to understand, how are those decisions going to get made to deal with these sort of potential conflicts. And so when you're looking at all these different partnership relationships, these are different things that you want to see about, what's important to you, and to find the right sort of mix of relationships. And this will apply to really any sort of place that you get into, any job, be it an outpatient lab, a university position, whatever it is. But I think that the number one thing people fail to, or don't look careful enough at, is what is your exit plan? It's really rare now to see people do 30 years at group X and then retire from that group. And so it's a really reasonable thing when you come into a relationship, is to go, how are we getting, what's our divorce look like? Either be it when I die, when I retire, or we decide we don't like each other anymore. Whenever you guys are coming out, you're looking at contracts, looking at jobs, look at what it's like to leave. You should understand what it's like to leave a relationship and make sure it's decided upon. I can't emphasize that enough. And you also need to have a mechanism for conflict resolution. Conflict is normal. It happens in these relationships. And you should understand how this is done, regardless of where you end up working. And then, of course, regardless of where you're working, you're going to get into lawyers and agreements. And these are really complicated things. And I'm amazed at, early in my career, how many employment agreements I signed with actually not having an attorney look at them. At this point in my life, I don't care if it's the simplest agreement in the world, it just gets fired off to legal. And I think physicians make a lot of bad decisions thinking they can actually read and understand the implications of some of the verbiage in these agreements. It's just not a world we operate in. So I really, really urge you to look into this. And it's painful. It's painful to drop $20,000, $30,000 on a lawyer to flip through some paper, but I cannot emphasize it enough. And this also gets down to, what is the asymmetry in this agreement, right? You can have the best lawyer in the world and come up with the best agreement in the world, but how are you really going to hold this other party accountable, right? So if you're sitting there and you're joining a private equity OBL lab that's worth, tens of millions of dollars, and you're a guy making a few $100,000 a year, you get into a fight, you need to realize how much money you need to hold the other person accountable, right? A big private equity company, they've got time and money, which are two things that in general you and I don't have. So really think carefully about these agreements that you may get into. You don't want to be, you can add into these agreements different ways to manage conflict resolution where you're not in the position of having to get a lawyer involved, because it just gets enormously expensive. And you want to, again, you need an exit strategy so you can get out without giving up everything that you've put in. So really important things to think about. Non-competes, pretty much everywhere, anywhere you take a job, you're going to be asked to sign a non-compete, and the majority of the time you're going to have to. Obviously, you want to limit the scope and keep them as reasonable as possible. You know, I mean, we use non-competes to protect our business, but the flip side is non-competes are used to also take away your power. So really understand what your non-competes are. I think we get told a lot of times that these non-competes are not enforceable, and it will depend on what state you're in, but they definitely are enforceable and can really impact your life and your family's life. So be careful about them. And then, as you can imagine, a lot of these office-based labs fail, right? It's not just a panacea where you open your door and you're doing 20 atherectomies a day and making $1 million a year. That's just not the reality of it. They're an enormous amount of work getting the new business up and running and to the point where it's financially viable. So these things go wrong because particularly because of business relationship problems, physicians get involved with these private equity management companies, and it can be a pretty difficult relationship to live in for a long time. Your business plan, I can't emphasize enough, it doesn't mean you need an MBA to do a business plan, but you really, really, really need to understand the business, the payment mechanisms, how the money works, just critically important. Management of these entities is really complex, and there's some of these things that we're not really good at doing. So, you know, I look where I am right now, and we're in an enormous growth phase and adding staff. And, you know, how do we manage culture? How do we manage the work environment that we want to be in? And we give a lot of thought to that. And we, you know, I engage with outside people to come in, help us manage our culture so that we're not, you know, when people get busy, there's a lot of sniping or other kind of issues. So this is really, really important. And it's one of the real wins of being in an outpatient lab is managing. You can set the tone and the culture for your organization, and it makes it really enjoyable to come into work. People are happy. It works out great. Your product might suck. So if you're not good at what you do, be really careful getting out into a highly competitive marketplace. Certainly where I am, you know, bad outcomes just would be death. There's not, it's just not, wouldn't be tolerated. I can't get away with it. And then, you know, we also fail because you walk into a place that there really is no market for you to be in. And this is one of the big concerns we see with all the consolidation that's going on in the healthcare market. And it's interesting that latest issue of JAMA had 2 articles on how bad this consolidation is for healthcare because of the elimination of competition in the marketplace. So hopefully we'll see pressures coming where this goes away, but it's certainly a problem. So, you know, my takeaway for you guys is, you know, you're the expert, you're the product. Really remember that you're the thing of value. It's not the center or the C-arm or all the fancy toys that you may have. Really understand what your partner's motivations are and potential conflicts of interest. Make sure you get legal help before you sign anything, even a simple employment agreement. You've got to get a lawyer to look at it. I can't emphasize enough the importance of doing that. When you have these agreements, try and find a way to have dispute mechanisms that don't involve lawyers, and try and keep your non-compete to as little as possible so you can do stuff. And, you know, business, again, to re-emphasize that it's, you need help. It's a team sport, and there are really different kinds of people that come in that can help you be successful, and you can't do all all three of these. And if you think you can, then you have a problem. That's setting yourself up for failure. You need to really know the things that you do well and the things you don't do well, and to hire people to get you through those. So.